Accomplished nothing at yesterday's health care summit. Will the Democrats turn to reconciliation and try and jam this health care bill right down your throat? Joining me now with answers are two people who were present at yesterday's proceeding, Tennessee Congresswoman Marsha Blackburn and Louisiana Congressman Charles Bustani. Guys, welcome back.
Great to be with you.
Thank you. Good to be with you.
All right, Congressman, let's start with you. First of all, you were in the room. I wasn't there. I'm watching on TV. I'm fascinated by the whole proceedings. I found the president talking down a lot. He seemed arrogant. He seemed impatient. Every time somebody made a good point, well, those are the talking points. I won. That's not true. These are talking points again and again. What did you make of that?
I thought that what he did was spend a lot of energy and a lot of time in condescending to people and discounting the ideas that we were bringing. That is time and energy that could have been spent saying, how do we address medical malpractice and tort reform? How do we address interstate purchasing of insurance? And I found it to be completely counterproductive. What it did do was make a great point to the American people that, look, this is how this is happening. When we bring ideas forward, when we put them on the table, this is the kind of response we get. And Sean, for the first time, they were in the committee room, the cameras were going, and they got to see the disrespect and the manner in which Republican ideas are treated when they are put on the table for discussion, and that discussion doesn't happen.
Congressman, your thoughts?
Well, I agree with Marsha, and it was interesting that he belittled the fact that we had the actual bill there on the table in front of us. I mean, we're legislators, and we're talking about points in these bills, and so yes, I think he really was somewhat condescending about those things. We wanted to have a real substantive dialogue on these issues and really highlight where we stand, where they stand, what those differences are, and how can we bridge those if possible.
Well, I got to tell you, it was very impressive, including the both of you and Paul Ryan and Eric Cantor. I thought there was a good group of Republicans. Obviously, you went in there with a strong strategy, and I think by every account, when the media says it's a draw, you know that's a loss for Barack Obama. I mean, I think that's a pretty good way to put it. All right, the issues that stood out for me, and I think for a lot of other people, most people that I know were extraordinarily angry at the process. The fact that they had to buy senators' votes to get this thing passed. The fact that Republicans were kept out. The idea that the president refused to take the invitation by Lamar Alexander to take reconciliation off the table. Congresswoman, was that a mistake? Did he miss a moment to prove to the American people he's bipartisan?
I think the president did miss a moment, and I also think that Leader Reid and Speaker Pelosi missed that moment, as did the vice president. They're the Democrat leadership. They control it all. They had the opportunity to say, the American people don't want this bill. We need to scrap it and start over with a clean sheet of paper. They passed that opportunity. The president should have looked at those leaders and said, you know what? The American people don't want it done this way. Let's go through regular order and produce a product that everybody, Republican, Democrat, all Americans are going to be proud of and are going to benefit from. But he gave up that opportunity, and I think in doing that's why today people are saying Republicans won this, or it was a draw, or they're further away from achieving their goal today than they were yesterday.
Congressman, I agree with everything that the Congresswoman just said. You're a distinguished colleague. I got to get this lingo down that you guys have. Although the president, I thought, could have been a little more respectful for people's titles, but that's another issue for another day, and I don't want to nitpick here. Here's my concern, Congressman, that I have. I don't want to run this by you. I think they could still force this bill down America's throat, and I don't want people to become complacent. I've had a lot of smart people on the program that are warning that Republicans may not take back the House. They may not take back the Senate. This is not a slam dunk. I don't want people to become complacent there, which is why I wrote a book that I'm going to be releasing in a few weeks, because I think we can screw it up, and I don't want people. The Democrats now have time to recover. Do you agree with my concern that maybe we need to really stay on offense here, that there's a lot of ground and a lot of work yet to do?
Absolutely, Sean. We're intent on earning the majority back, and it starts now, and it will continue, and we will escalate that effort as we go forward until we get through the next elections. You know, the American people have spoken very loudly, and I can tell you as a doctor with 20 years experience, talking to a lot of folks in my district and around the country, they want to start over on this health care bill, and they want us to get it right. We have a duty to do something about health care, but we really have an obligation to get it right. And that means bringing down the cost for families and small business owners and not bankrupting this country. And so we're intent on moving forward, putting our ideas out there, holding to our conservative values. And I'll tell you this, we're going to work hard to earn the majority back.
Well, I got to tell you, this is what I think this election is turning into, which I think is good. It almost reminds me of Reagan versus Mondale, Reagan versus Carter. Great distinctions between the two parties. That's going to give the country a choice in terms of its future direction. So, guys, thanks for being with us.
Absolutely.
Sean, thank you.
Thank you so much.